Coming up on this week's edition of Being Well, Carolyn Sutton, clinical social worker from Paris Community Hospital, will be here to talk about children and grief. We'll discuss the ways in which children deal with the loss of a loved one. Carolyn will provide advice on coping methods, how to talk to children about death, and ways to remember loved ones. That's next on Being Well, so don't go away. Production of Being Well is made possible in part by Sarah Bush Lincoln Health System, supporting healthy lifestyles, eating a heart-healthy diet, staying active, managing stress, and regular checkups are ways of reducing your health risks. Proper health is important to all at Sarah Bush Lincoln Health System. Information available at sarahbush.org. Additional funding by Jazzercise of Charleston. Thank you for joining me for Being Well today. As I said in the intro, Carolyn Sutton returns, clinical social worker from Paris Community Hospital. Welcome back.
Thank you.
It's great to see you again. Today we're talking about children and grief, and it was a topic that we didn't really have a chance to cover on your last visit, so we wanted to revisit that and visit about that topic. So let me start first by asking you, Carolyn, in general terms, how do children deal with grief differently than adults?
Children do deal a little bit differently than adults in that the young child grieves in a behavioral manner. Mm-hmm. They are not able to express exactly what they're not able to name the feelings, so they really act it out, and that might be in a number of ways. They might do some regressive behavior like bedwetting or thumb sucking. They might be very clingy, and they also get their cues from the adults in their life, how they are handling the grief.
Okay, so even before someone passes away, what do you think, when and how should a parent talk to a child about death in general?
You know, that's a good question, and I should say that it really depends upon two things really in terms of when someone should discuss it and how, and that is the developmental phase of the child and also the relationship that the child had to the deceased.
Okay.
Those are really critical because young children really don't have a full concept of the finality of death. So they don't know whether the person, they always kind of think they're coming back. So I would say that parents should talk to children about death fairly soon after the death occurs, if at all possible. And use simple terms, simple language. The more simple, direct, honest, and open that a parent can be, the more comforting I think that is to a child.
What about if children have questions about death? A friend of mine, they were driving in the car, and her son, who's about 2.5, saw a cemetery and said, "Mommy, what's that?" I mean, how young is too young, do you think, to talk to children about things like death?
Well, certainly if a child is asking the question, it's upon us to try to explain in some kind of way that the child might understand. And I stress simplicity because sometimes we get carried away with trying to do too much, and the child just might, particularly when a death has occurred, the underlying concern generally has to do with, am I going to be okay? Am I safe? Are you going to be here with me? So in terms of this cemetery incident, I think that you have to know your child and kind of have some idea about where they might be going with that. And, you know, I think you would take into your cultural background and religious background and how you see that. How do you see the cemetery? How do you see death? And so I think that would really gauge how you might explain it to your child.
So how does a parent, say a spouse died, so you have the wife who's lost her husband and you have children. How does someone even begin dealing with their own grief, let alone that of their children?
That's tough, but parents can do that. They can grieve with their children because everybody is hurting. Everybody is going through some changes. So I don't think that parents should keep their grief away from the child, because again, we want the atmosphere to be open. We want it to be caring and compassionate. And you might say, how can I be caring and compassionate when I'm grieving and I'm hurting so much? You just can hold the child and tell them that you miss your husband too, you miss daddy too, and let them know, first of all, that it is okay what they're feeling. That's really important, so that they don't get the idea that I saw mommy crying and she's upset and I caused it, or something bad is going to happen. To just kind of try to kind of go with the child, and you know, children will let you know what they need really if we have an openness to that, and that the parent might have some time when they need to be alone to have that real deep, you know, crying spell or sadness. But I don't think they should shield the child from that.
That's what I was going to ask you. In your practice, do you have parents that say, I can't cry around my child, I can't show them really how bad this is, I have to be the strong one here?
Yes, I do. I have both. Some people can just be themselves and cry together with their child, and the others are a little bit more protective and try not to do that. And we encourage them to really, you know, start some new traditions and bring the child into that. You know, they might do some things like look at pictures together and remember dad or mom. And again, the underlying concern is, am I going to be okay? Are you going to be okay? And so I think parents can demonstrate that by showing that they care and they're crying, but also giving them the hope that things will get better. It will get better in time.
Do kids tend to have that feeling of something's happened to dad and dad has died and it's going to happen to me too?
Absolutely. The other thing that we like to stress is that again, to be as honest as possible when you're talking to children, and don't overpromise. Don't promise something that you don't know whether or not it can be fulfilled, because we want them to trust us.
So, like overpromise?
I'll never go away. You know, I'll never die. That's just a big one. And you might say, especially if it's a small child, and you know, you might say that I'm going to be with you for a long time. You know, we're going to be together for a long time. I miss daddy too. These are some of the things that we can do together, and try to develop some routines that would help the child feel stabilized. That's
Such
really
as
important.
what?
There might be some, the routine of eating together, going to bed at a certain time together. You also want to be able to allow the child some of the decisions that have to be made, because this adds a sense of normalcy or certainty or control. Because again, when this death occurs, everything is out of control.
Right, and everything that was normal is no longer.
Exactly.
And depending on what happened, you know, I would think, you know, changing everything in the house, getting rid of everything. Sometimes you have to move. I mean, that's traumatic enough for, or difficult for any child, whether there's a death or not, just that change in routine.
Absolutely.
So do you as the parent need to be cognizant of not changing everything right away, or how should someone go about, because that is part of the process, is at some point getting rid of, you know, the spouses or the deceased things, but not trying to do that maybe all at once.
Yeah, and we talk about really, if at all possible, not to make any major changes for at least a year. And you're right, sometimes a child might have to change a school because they have to move. In that situation, you want to have the adults in that child's life to understand what has happened and to be more supportive, particularly teachers, for example, their friends, aunts, uncles, anybody that is in their safety network can be of support by just being with the child, being present. You know, being with and being present are different, and so being with the child in terms of where the child is at that time.
So how, if a parent has lost a spouse, I just keep going back to that scenario, you know, you're devastated yourself. I mean, how can you give comfort to your child when you're hurting at such a
degree that you can't hardly maybe get out of bed that day, and then you have children to take care of as well.
That's tough. However, if we can find some activities, you don't feel like it. A parent wouldn't feel like it, but parents also want to protect their children, and they really want them to adjust to this. So there is this inner strength sometimes that we just kind of pull up, and mom or dad might do things together. For example, they might have some drawing materials, and really that provides the parent an opportunity to get some feelings out as well. They might use some Play-Doh. They might create a journal together. They might develop a tradition of lighting a candle, and the adult is also getting some benefit from this as well.
So you had said, we've talked about in our previous show, there are stages of grief, and do children follow the same kinds of stages of grief that adults do?
Children have the same feelings of loss that adults do, and that would be depending again upon the developmental phase of the child and the relationship of the deceased to the child. The child can often feel angry, but they might not say they're angry. What might they do? They might get into fights at school, throw temper tantrums, be very fearful. They might start to worry. If they are worrying is one thing. The sadness, you can tell when a child is really sad. They might talk a lot, or they might not talk a lot. Again, you really kind of need to keep in mind who your child is. But in terms of the phases, so we know we have the denial and just not being able to understand or accept. So that would be sort of first. And with Kubler-Ross, we talk about the 5 stages, and nobody goes through them 1, 2, 3, 4, 5.
Right, and then
they're back and forth. and the same thing with children. The child might be very sad at one point and start playing again, and then come back into it. So then there is the bargaining. That's one of the stages. So the child doesn't understand bargaining, but the child in his head might say, if I just could have done this or that, or if I hadn't done this or that, Dad may still be here. That's the same concept, but they don't name it that. And of course the depression, just not being able to play with kids the way they've played before. So yes, I would say they go through those stages, but not name them as such.
I wanted to go back to, you said the bargaining or blame. Is that a common thing for children to maybe blame themselves for the death of the parent, or they can rationalize or come up with something in their head like maybe that's what happened because I acted out and maybe that's the reason why?
Sometimes that can happen, and that is why it's very important for parents to have that conversation so that they can explain to the child and give information about the death. One of the things that's also important is to allow the child to ask questions and to be able to answer those questions so that the communication is open and the child can get an idea that they didn't cause it, and we want to tell them. We want to really let them know, no matter what you said or did, this did not cause the death. Because yes, children do sometimes blame themselves. They don't know.
And that's, for the parent or an adult to sit down and really explain that. Because as an adult, we know that in our head that, what we said did not cause the cancer or whatever. But for a child, it's just a whole different mindset.
It really is. And I think giving a child that opportunity to just, when we are compassionate with them and when we give them the space to tell us things, and they may not tell us in the way that adults tell, they might tell it in their play. So you want to be attentive to how the child is maybe playing with the doll or the Play-Doh, or what the pictures that they're drawing. What does that mean? Tell me about that picture. And then you will get what's going on with them. And that's why I stress being present with the child, being attentive, listening to what they are giving you, and please to not be judgmental about what the child is saying, because what we want children to understand is that their feelings aren't right or wrong, they just are.
Yeah, they're their feelings.
They're their feelings, and we are not judging that, but we are trying to help them to develop some healthy ways to cope with what they're feeling.
You had mentioned depression. At a certain point, when does it go from being grief for the child to something more serious like depression or anxiety?
I think that, first of all, if we kind of understand some of the normal signs of grief, which is like crying, sadness, talking a lot or not talking a lot. You know, we talked about the regressive behavior, maybe staying to themselves more. So you look at all of the normal things that we do when we are grieving. And then if those things persist over a prolonged period of time, that's when you would want to kind of get a little bit concerned, but more have that conversation. For example, if a child is not getting comfort or enjoyment out of, let's say, the iPhone or the some games on TV or watching TV or iPad, and this is just prolonged, then you want to start checking that out. If you're seeing some things over a longer period of time, because children are resilient and they usually do bounce back.
Right. I was going to say we tend to say children are resilient; they'll be fine, but maybe not all the time.
Maybe not all the time, and having that clear relationship with them and knowing kind of your child is just critical to that, because I think parents, when they are really in tune, you kind of know when things aren't quite the way you think they ought to be. And I would tell a parent, if you're really concerned, then I think we should seek some additional help.
So when you had said over a long period of time, is this like 6 months after the person has passed away, if your child has not kind of started to bounce back? Is it a year? I mean, I don't like putting timelines on grief, but at what point do you think generally would you start to see the child kind of start to ease back into something a little more normal? And if at that point they're maybe not?
That's a tough one, because you know we have that with adults. You know, what's the timeline, and people ask that all the time.
Right.
And there is no timeline for adults. I mean, it just, you know, we grieve in different ways. Our grief is unique, and so for a child, you want to look at things like, you want to take into consideration more than just that. So are the grades okay? You want to check that out. Are the friends, are they just pushing everybody away? And this is, I would say, you know, again, we need to look at the stage of development and the relationship to the deceased. And we need to look at how adults in that family are grieving. Because if you have a mom or dad who's shut in the room for 3 months, well, what are you expecting from the child? Because they are, again, taking their cues from the adults in the environment. So it's kind of hard to say, but I would say, you know, it also depends on how the person died,
right?
Whether it was sudden or whether it was a long illness. Was that the custodial parent or not? There's a lot to consider. And I just kind of go back to, you know, your child. It's hard to put a time on it, but you know, I think I would base it on kind of how I'm getting along as a parent.
Right.
You know, so 3 months, you know, or less. It's hard to say.
We've kind of been talking maybe more in terms of children. What about teenagers? Because teenagers themselves can be problematic. If you have a teenager, you know what I'm talking about. You've got hormones, they're growing. Do you see in your practice different issues with teenagers dealing with grief versus maybe like a younger child, like 8 to 10?
Yes, yes, and I'll tell you, you're smiling because, you know, adolescence is time of turmoil.
Right, anyway.
Up and down, anyway. Developmentally, they're beginning to break away from the family. They're beginning to set limits and boundaries for themselves outside of the family. They want to establish their identity, and they want to be cool. So, crying and fussing is not really cool. So teens tend to keep things a little bit more tucked away. Or they might then act out in sort of risk-taking behaviors.
Right.
They may start drinking, they might drive fast in the car, they might really break curfew, those kind of things.
Right.
So I think we need to, it's very difficult to separate the adolescent development from what's happening, with the grief. But again, if you're seeing things sort of really prolonged and also excessive, I would say excessive.
Now, do you recommend like family grief counseling, or is it better if the kids go see a grief counselor separately? I mean, what is your recommendation for a family that may be in the midst of this right now?
Clearly, my background is family therapy,
Yeah.
so I definitely wouldn't send a kid off to grief counseling by themselves. I think it's a family issue. I think that if a child is struggling, pretty much probably the adults are struggling also.
Right.
So I think it would be a family assessment, and then the therapist would determine whether or not this would be a family gathering or whether she would see kids individually. But I think that when parents are concerned, by all means, get an assessment.
Right. At what point do you maybe recommend, maybe you don't recommend grief counseling 2 weeks after the death of someone. When at some point do you kind of make that recommendation that maybe if it is a death in the family and there's children and a single parent left, at what point does everybody need counseling?
Everybody does not, because it depends upon the support system that people have. Sometimes people have grandparents and uncles and aunts and people that's all around them. And again, to go through the stages of grief and to have this sadness and profound pain is normal. So you can't really take that away.
Right.
If I could take it away, it wouldn't be there. It's hard, it's painful. I think, again, if there are troubling behaviors would be when intervention should happen. And I think that if parents have a relationship with teachers at school, because sometimes they see things that parents might not see.
Right.
So if they have that relationship, and we're noticing things differently at the school, and this could be, a month or so out, because again, that first few months, everything is in turmoil.
It's very chaotic.
And that's just part of it. And it would be hard to sort of assess, whether or not some intervention needed to happen. For example, some parents need medication. I don't really like medicine, sorry. Because I think grief is normal. It's normal to feel all of these things. And if you sidetrack it with a lot of medication, it comes back later. Now, I'm not saying some people don't need it, because they do.
Right.
But that's for a physician to make that, assess that. So sort of the same thing with kids. I don't know that they need a lot of intervention right away, because it's so new and it's so different. And we would want them to be able to just kind of be how they are, what they're feeling. And then after some weeks, several weeks, I would say, if things are just still in the dumps, just can't pull up, just can't do it, then I would say seek counseling.
As we wrap up here, let's talk about some positive ways that children can remember their loved one as birthdays come up, as holidays come up, and special memories. Positive ways that they can remember that loved one, that they can celebrate that life, but not dwell in that life. What would you say?
Well, first I would say maybe sit with the child and come and talk with them about the positive memories that they had. Pull out the pictures, look at the pictures, and there'll be some tears there, but it doesn't always have to be very, very sad tears. You can remember when you first went on your skating trip or something like that. I would say make new memories, make new traditions. You might decide not to go to grandma's this year. At Christmas, we're going to go to auntie's house. Develop some things that you and your family would happen as a result of this loss. You might do some things differently. I think journaling is a really good way, and we tell adults to journal all the time.
Yeah.
Children can journal too, and make their own little box of things that they do with the Play-Doh, with the crayons, with the watercolors. They might want to plant a garden together. That sometimes can be very nice, or even just a tree. Anything that says this is for my dad, this is for my mom. They might want to make something. They might want to bake a special cake on a special day, and name that. Have friends over, or just have the family. But it's all about knowing that your loved one is not going to come back, but to do some things that maybe your dad or mom would have liked, that the parent that died would have liked, and to have that as a remembrance. Sometimes kids do things at school to remember a parent. So to engage others, to engage the family in some of these activities is really a good way.
All right. Well, Carolyn, it was great to see you again. Thank you for coming over. I know this is a topic that, we hope no one has to go through, but there are families out there in our community that are going through this, and I hope that the information that you've shared is helpful to them in this process.
Thank you, Lori.
Thanks.
Production of Being Well is made possible in part by Sarah Bush Lincoln Health System, supporting healthy lifestyles, eating a heart-healthy diet, staying active, managing stress, and regular checkups are ways of reducing your health risks. Proper health is important to all at Sarah Bush Lincoln Health System. Information available at sarahbush.org. Additional funding by Jazzercise of Charleston.